Recording in progress.
Hello, lovely women, and it's day 20 of the period party. It's unbelievable that we have been spending 3 weeks together and we still have 10 days to go before the end of this wonderful, wonderful month. I've been having the best time. I've been enjoying the conversations with all of you. I've been reading all your comments and I've been trying to respond to all of them, and please let me know if I didn't, so I'm going to rectify that as soon as possible. Actually, if you have a question that I have not really answered, just post it in the comment section. And just so that you know, towards the end of the week, I'm going to answer all your questions. So just watch out for a post that I'm going to put up in the next couple of days, so then you can ask or whatever it's in your mind, and then I can make sure that I'm going to address it for you. Also, fantastic news tomorrow. Jade Cameron, which is my partner in crime and the founder of the It's a Mind Game podcast and the mindset coach of the Period Comeback Protocol, she's going to join me live tomorrow, 1 p.m. Sydney time. If you're going to be sleeping by then, don't you worry, you're going to be able to catch the replay. But I'm always very excited to spend the time with her live, because it's also our chance to connect and speak about all the things: eating disorder, hypothalamic amenorrhea, training, hormones related, which is my passion, as you possibly know by now. Also, last thing that I would like to mention is that last week I discussed about finding a way to support all of you that missed out on the Period Comeback Protocol, that I couldn't really join a couple of weeks ago. And at the moment, I don't think that I'm going to be able to take on anyone for the time being. So just to let you know, I feel really awkward saying that, and I apologize. It's just myself wanting to try to help everyone. And when I get to this place when I don't have the capacity to do so, I don't feel that great. I don't feel that great, because I really want you to get your period back and to have a baby and so on and so forth. So watch out for my Instagram post today. I've just launched our 10 days only offer. So if you're really keen to getting started and to really get your hormones, your period, and your mindset back on track, that's something that you can join starting today, only for the next 7 days. So make sure that you don't miss out on that opportunity. And if you're part of the period party, you're going to receive an email later on, and I'm going to tell you more about this wonderful, wonderful offer. Now, without further ado, PCOS versus HA. So how many of you has been diagnosed with PCOS? Towards the beginning of the recovery, or maybe they still are quite unsure right now if they're dealing with PCOS or hypothalamic amenorrhea. And if that's you and you're watching this live or replay, just post it in the comment section and simply say, yes, diagnosed with PCOS, and I would love to hear your story and how they come up with that kind of diagnosis. So, for example, I was definitely misdiagnosed with PCOS in three different times of my life. When I was a teenager, towards the end of my 20s and mid-30s. And it was always that recurrent misdiagnosis, and they were missing out really important pieces of the puzzle. And thankfully, now the medical system has been really catching up with the research, and now they're more careful to identify PCOS and HA or other hormonal imbalances. But once again, it happens quite frequently that women get misdiagnosed with PCOS. And if this is you, please let me know in the comment section. Mind you, there are some of you that may also be been experiencing PCOS and hypothalamic amenorrhea at the same time. And I had 2 wonderful clients that went through exactly the same thing, PCOS plus hypothalamic amenorrhea, and they still managed to have regular periods and getting pregnant. So don't you worry, this is not a death sentence if you have both. It's just all about prioritizing hypothalamic amenorrhea to then address PCOS. And it's also very important to understand the root cause of why your body is presenting with a hormonal imbalance. And the work that I do normally is to really recharge and reset your hormones. So it doesn't really matter if you're coming with hypothalamic amenorrhea, PCOS, or a combination of both, we can still get wonderful results, because most of the time what women need is to be heard, to follow proven steps and to get the right tools, so they can move forward without trying to throw spaghetti on the walls, hoping that one is going to stick. But going back to the basics, so how can you diagnose PCOS? So normally PCOS is diagnosed with the Rotterdam criteria, and there are 3 criteria. Actually, there are 2 criteria that you need to fit amongst 3. So one is high androgen, one is irregular or missing periods, and the third one is a cyst in your ovaries. And sometimes when you go to a doctor and they see lots of cysts in your ovaries, they do mention that you have polycystic ovaries. That does not mean that you have polycystic ovarian syndrome. It simply means that you have plenty of follicles in your ovaries. So to be diagnosed with PCOS, you need to tick off 2 out of these 3 criteria, right? So high level of androgens, missing or irregular periods, and the last one is polycystic ovaries. So you can very quickly recognize that 2 out of the 3 happens also in hypothalamic amenorrhea, right? Because normally women with hypothalamic amenorrhea, they do present with missing or irregular cycles, or maybe they think that they have been irregular, but the reality is they have been missing for quite a long time. And secondly, they tend to have lots of cysts in the ovaries, and they tend to have a high AMH level, which is the anti-Mullerian hormones. Sometimes doctors, they do diagnose PCOS based on the high level of AMH, and I'm still beyond baffled by that, because AMH is not a tool to diagnose PCOS, hypothalamic amenorrhea, and anything else. It basically tells you how many eggs you have left in your ovaries. It tells you everything about the ovarian reserve. It doesn't tell you anything about your hormonal imbalance, and it doesn't tell you anything about your egg quality. So right from the bat, you can understand there are very strong similarities with hypothalamic amenorrhea and PCOS. So how to understand which one is which? So first of all, the most simple one, look at your menstrual cycle. If it has been missing for more than 6 months, I normally say, less PCOS picture, more of an hypothalamic amenorrhea pictures, or combination of PCOS and hypothalamic amenorrhea. Simply because with PCOS, women tend to have irregular cycles or missing periods that they do appear every 3 to 4 months. So if you haven't seen anything for more than 6 months, normally there is always something else brewing underneath. Secondly, it's very important that you self-advocate, meaning that you advocate for your health. So whenever you go and speak with your doctor, just make sure that you ask the right questions, make sure that you ask explanations. So for example, if they say, we do believe that you have PCOS, why? How did you come up with this diagnosis? And how do you think that this diagnosis fit with my lifestyle? Do you want to ask me more questions about my background and my current life situation? Ask all these questions to your doctor, so then you can really leave the clinic thinking, okay, now it makes sense in my head. Now I know which steps I need to take in order to get better. Because there is nothing more frustrating than speaking to a medical professional that you trust, and then leaving the office thinking, what am I meant to do right now? What am I meant to do? Also, something that I completely forgot to mention, women think that the treatment for PCOS and hypothalamic amenorrhea, they are completely the opposite. One is all about exercising more and eating less carbs, and the other one is training less and eating more. The reality is that it's quite untrue. There are 4 different types, even 5 different types of PCOS, and they need to be addressed in different ways. And possibly there is only one type of PCOS that really benefits from moving your body more. But all of them, they really need you to nourish your body properly, consistently, and to have the right micronutrient. So replenish all the macronutrients that have been depleted, which are possibly the root cause of your hormonal imbalance. Not to mention that we always need to address mindset and gut at the same time, which is something that I would do also with women suffering from hypothalamic amenorrhea and other hormonal imbalances, right? So first step is to really advocate for your own health when you speak with a professional. Get a good understanding of why he came up with that diagnosis, what it means for you, and what are the steps for you to take moving forward. Second of all, as I mentioned before, check your menstrual cycle. If it has been missing for more than 6 months, chances are that it's more hypothalamic amenorrhea than PCOS, or once again, a combination of both. Third, background history. Normally, the doctors don't have enough time in their schedule to really sit down and listen to you. And that's what I do, because that's my profession. It's not their job to really sit down and have a nice conversation with you for 45 minutes to really understand what has been happening in the past couple of years. But normally, if you look at your background history and also your current habits and the past habits that you have been engaging in for the past three to 6 months to almost 2 years, you will know if you're dealing with PCOS or hypothalamic amenorrhea. Normally, women with HA, they tend to have some disordered thoughts around food and training. They have been trying to control their body through food and training, and they tend to have obsessive behaviors in terms of the relationship with food or the way that they train. So these are a couple of red flags for you just to notice if you're still undecided between which one is the right diagnosis for you, obviously. And I think that these are the things that I normally would like you to get started with. I don't want to put too many things on the fire because I don't want to overly confuse you. I'm gonna also discuss about thyroid, adrenals this week in the next lives, but for now, I really would like you to sit with the thought of, have I spoke with my professionals? Have I spoke with my medical practitioner? Have I asked her the right questions? Have I asked him or her, how did he come up with that specific diagnosis? Do I have a polycystic ovaries? Do I have irregular cycles that have been missing for more than 6 months? Have I tested my androgens? Have my androgens been elevated? Have I also noticed some acne on the back of on my back or on my chin or on my face, or also on my chest or different areas of my body? Have I noticed any hirsutism? Hirsutism is normally hair growth in places where women don't normally see hair growing. So for example, it's like the mustache, once again, the chin, and I'm not talking about a couple of hair that you can pluck out without any problem. I'm talking about recurrent hair growth that you tend to shave on a daily basis, or maybe hair growing on the chest once again, or a lot of hair around the nipple area or on the back. So start asking yourself this question: have you noticed any hirsutism? Have you noticed more acne than usual in places where you have never developed it before? Do you have a past history with eating disorder? Do you have a past history or current history with disordered thoughts around food and training? And start to really write down the answer to these questions and just notice which one is you, which one feels right for you, let's say. And then once again, speak with a professional that knows a lot about women's health, that knows a lot about hormonal health. And if I'm not your cup of tea, that's absolutely fine. You can find someone else. There are plenty of us in this planet, but just make sure that you find someone that can really support you so that you can start following proven steps. And just to let you know, if you are presenting with PCOS and hypothalamic amenorrhea at the same time, hypothalamic amenorrhea needs to be addressed first, because you cannot heal your hormonal imbalance and you cannot heal your PCOS without really identifying, first of all, which type of PCOS you're dealing with, and secondly, when you're completely undernourished. Because when you're undernourished, and when I say undernourished, it doesn't mean that you have to restrict your calories. Maybe you're restricting some important macronutrients, maybe you're eating at the wrong in the wrong part of the day, or maybe you're training more, or maybe you have some undealt trauma and grief that is constantly in the back of your mind. But if you have not addressed the deprivation, let's say the scarcity, you cannot really start to replenish those beautiful hormones. You cannot really ask your body to function in homeostasis and perform at its optimal level. All right, so just in the back of your mind, if you come up with the idea that maybe you have PCOS, beautiful. If you have HA, fantastic. If you have a combination of both, HA needs to be treated first, so then you can move forward and start treating PCOS. Also, just to give you an idea in terms of a timeline, normally hypothalamic amenorrhea, if you really address the core issues and you give your 100%, you can really get your period back within a 3 month frame. In terms of PCOS, that normally takes a lot longer and normally tend to suffer from menstrual irregularities for approximately 6 to 8 months. So make sure that you enter this space with lots of patience, lots of curiosity, and lots of commitment in terms of getting your hormones and your health back on track. Thank you so much for being here today. I really hope that I've answered some of your questions. If you have some more, just please post them below, post them in the comment section. Let me know if you've been misdiagnosed with PCOS in the past. And if you missed out on the period comeback protocol and you would like to receive the support and the guidance that you deserve and that you need to move forward in life, if you want to follow some proven steps, make sure that you check my emails today or that you jump on my Instagram account, and you will see that I've pinned something on the top so that you can take advantage of what I have to offer. Thank you so much for today, and see you all tomorrow. Bye for now.